After 15 years of being in dental hygiene, I wanted to expand how I could take care of a person. I didn't switch necessarily from dental hygiene to nursing, as I felt like I continued. I studied the head and the neck, and now I'm going to go from the neck on down.
The people that have a heart for this typically have attempted some form of integration, like I did for my alma mater, Ferris State University, with a large healthcare system. And when I found out all of the barriers that were present, I knew that we needed to do something big to change it. We're perfectly poised to be that bridge between these two silos. People keep saying break down the silos. That's not working. So we've got to be the bridge.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 216.
Nice. I'm glad you remembered that.
Yes.
I definitely did not.
We are coming to you from Chicago midwinter.
Yeah.
And yes.
And you're
cold.
Andrew, and I'm Michelle.
And I'm Andrew, one of the co-hosts.
And I'm Michelle.
I feel like I'm out of sync right now.
Would you like to redo this?
Nope, I don't.
Okay.
You know why? Because our audience doesn't care.
They
love us anyway.
But if you're new to this, we are normally better to the
this is why we have Michelle.
And welcome to our little podcast. We would love for you to hit subscribe if you're new or have not listened before, and go back and listen to the 200 plus episodes of amazing content that we have from lovely guests throughout the last 4 years. We'd love that.
True.
Yes. And today we are going to be talking about continuing our series on healthcare and when dental hygiene meets healthcare in a way. And we have Mary and Jamie on. We're going to have 2 interviews on this one. So we did them completely separate. I recorded Mary by myself, and then you and I are with Jamie. So you guys are going to enjoy this. But yeah, like you said, we're at Chicago midwinter.
We are, and it's cold. It's
so cold.
Look, I think we've been very lucky that we haven't had a lot of like snow or too cold of Chicago midwinters for many years.
Yeah.
And it is in the teens right now.
It is.
But that's still not too bad.
Do you know when we also happy anniversary at first meeting?
I said 4 years and I meant 5 years.
Was it 5?
Well, it wasn't. It was because 2015 is when we started. So it was 2016, 2017, 2018, 2019, and 2020.
Well, we're going into the 5th year.
This is the 5th year that we've actually
But it's our 4th
met.
anniversary.
Oh, is that how that works?
Yeah.
5 years? 4 years?
It's
the fifth time we've been at Chicago Midwinter.
This is our 4th anniversary of meeting in person.
How is that not 5th anniversary? Oh, it is the 4th anniversary, but it's the 5th time we've done it? No. Is that how that works?
The 2016 was the first year. You do not count that.
Oh.
Then 2017 was the first anniversary.
Sorry, everyone, I
second
don't know the
anniversary,
math.
3rd anniversary. Yes, thank God Allison doesn't care about your lovely wife about making sure you get right with your
she does not care about anniversaries. Thank goodness.
Yeah.
But yes, happy 4th year anniversary to you and us.
Meeting in person, though. That's crazy.
You remember that time? I
I think I just rolled up and I was like, hey, and we sat on a couch.
I did the red eye because I was dumb. And I think we were meeting Alan Mead, right? At his hotel.
That's right. Yes.
And I went to their hotel and I was like sleeping on the couch in the lobby when you came in.
Mm-hmm.
And I meant to be more excited to see you. And you came up, you're like, hey. I'm like, hey. Well, should we do this thing?
Let's
and
go.
then we went up to Alan's room and recorded.
I think that's why our relationship has worked so long, because neither one of us are real fake about anything.
Yeah.
You're tired. I was like in
let
the
me
mood.
be tired.
Let's
It's fine.
Just get this done and over with. And
Yeah.
that's good.
Oh, man.
But so far, we've had a really great meeting. We love coming to the Chicago Midwinter meeting.
Mm-hmm.
If you guys ever want tips or information, please let us know, because we'd love to tell you. We've worked so many of these exhibit floors.
Yeah.
And there's some good ways to do it and some bad ways to do it.
And every conference is a little bit different. Like McCormick, or where they have Chicago Midwinter, is like way south of the Loop, and like where should you stay, and where are the meetings, where are the events, stuff. So yeah, definitely reach out to us because we have some thoughts and ideas on helping navigate all that stuff.
It's a very different experience than like if we go to RDH under one roof, where we like never leave the Gaylord.
Yeah.
But this is always a good, fun meeting. This is a really big meeting, and it's also where people launch their stuff.
Yeah. It's like one of the first big ones of the year. And so it's historically been the launch of new products.
I think Yankee meeting would be terribly offended by that, but it is.
I said one of. It's one of the first big ones. Yeah, but because of that, that's why they always do all the launches and things like that. So
I wanted to bring something up on this intro, and I'm curious how many people do this or have even thought about this before. So, I'm not full-time with Tepe anymore. I kind of left my position as their North American educator, but I still do consult for them occasionally. And if in my area now, since, I have all this amazing Tepe knowledge in my brain, I still want to share it with the people.
Right.
And so I'm doing that more locally, where I'm like going to offices and just teaching them how to size inner dental brushes. So that means I'm walking into more offices than I have in the last 5 years.
Right.
And I'm curious, do you ever walk into your office and look at it from the patient's view?
You know how many times I keep saying how the way we do things is different in my business model, right? So I actually regularly do that because we have part of our third-party survey questions do ask questions about aesthetics, appearance, the interactions with the front office staff, interactions with all of the different individuals at every step of the way. So yes, I do, but I don't think that necessarily is something that everyone does.
I'm just fascinated by every office I walk into immediately has a different vibe. It's palpable.
Hold on. So are you talking about you're walking up into the front office and they have a different vibe, or
entering the building, the setup, the layout, the interaction from the moment that the front office or anybody in that office interacts with you. And then if I do make it past the gatekeeper, which some of these front office people, I really think we need to have a big conversation about like how you treat reps, quote unquote. Because I'm not a rep. Like, I'm not coming in there to sell you something. Like, I was asked to bring you something, or, hey, can you drop something off at a referring doctor? And I'm like, sure, I'm on my way. It's down the street from my house. I'll do it. Man, there's some jerks out there. There really are. I'm like, I'm not trying to like sell you this.
Right.
And I get like, maybe I'm coming from a different perspective than other reps, and maybe they just see us all as the same.
Could be
group, but man, there's some rudeness. But even just from the moment I walk in, the smells, the cleanliness, the setup, if it's inviting, to if that front partition is closed or open or partially opened, how does that person, if they're on the phone, can I hear a conversation? Is there like a HIPAA thing happening? Even to if the, let's say, assistant, somebody maybe back office, clinical, is talking to the front office team and they don't stop their conversation the moment I walk up to the front desk, and how they finish their conversation. And then it's like, oh, hey, how are you? What can I do? Like I'm annoying them by even opening the door and walking into their office. I'm just wondering how many people assess their customer service and how it feels when someone's walking into their practice. And I did go to a new dermatologist as well, like as I'm amongst all this. And just because it was more convenient, and I will not go back there because the vibe did not feel as inviting as my normal place.
Interesting. So let me ask some more questions about that then. How much of the vibe is aesthetic? So for example, newer furniture, newer pictures, fresh coat of paint, that kind of stuff.
Well, yeah, I think that's a big part for me. But then, yeah, it's pretty. So like, for instance, I've walked into an office where the facade was just really beautiful. Like everything was just beautiful. But when I looked at their equipment, like in the operatory, it's kind of old and dated. And I saw soaked gauze as they're cleaning, disinfection, environmental disinfection, right? It's just like little things like where the facade was really beautiful and looked like everything was like very elite and lovely. And then when I look at like the actual get into patient care, it was like old hand pieces and like it just kind of,
Right.
It wasn't really carried throughout all of patient care. But I think, everyone's aesthetics are different. I've walked in one office where I forget what country it was from, but it was very bold and bright colors. And I was like, well, this isn't my favorite thing, but everything was clean and it was carried throughout the office. And you could tell that he thought about the aesthetics of it. Not my particular aesthetics, but
sure.
But cleanliness is a big one, I think.
Do you feel like there's a chance that if someone doesn't have the most up-to-date facade, the most comfortable chairs, the newest, if they have a Highlights magazine from 94, like that kind of thing, is there a way that they could still win you over, though?
I think from the customer service part of it.
Yeah.
Like that's my initial, I walk in, I'm like, smells like a dental office, or this doesn't smell like a dental office, to like, oh yeah, they got some fresh flowers, like they have a Keurig and like a little machine and station. Like, I think I'm like, oh, that's very nice service. But if they don't have it, I could care less, right? Like, hopefully I'm not sitting in that waiting room that long.
Why do people have Keurigs out there? I just don't like that. Don't have a coffee right before you come see me.
Oh, my patients did it all.
It drives me crazy.
Yeah, I didn't enjoy it. I was like, like they would be at the Keurig machine getting it. And I'm like, hey, we're coming back. That's going to be cold by the time you get to it.
Yeah, way to waste.
Yeah, it's a waste. But then it really is more about that interaction when I walk up to that front office desk and like, maybe their back is to me because they were filing something. Like, do they finish filing or, interact with me the moment that I walk up to? I think it's more the customer service of it. Is that the best way to put it? Like,
no, I think so. I think you're right.
It's how you engage. You don't know if I'm a patient or not. These people don't know. Like before, of course, when I become like the rep, then they're like, we ain't got time for you kind of thing. And the gatekeeper is like, the doors are shut. Get the hell out of here.
Yeah.
And they don't even give stuff to the back office or any. It's just, that's a whole other conversation. But how I am treated when I walk up to it, is that a smile? Am I interrupting them? Are they even willing to like stop what they're writing? Like, what's your name? Who are you here for? You know?
And the thing is, like, we just recorded an interview that's going to be coming out here in a few weeks, and it was like talking about, yes, they're patients, but they're people, right? Like, it's like we're all freaking individuals and humans, and let's just be cool to each other. Like, doesn't have to be the, in their particular case that they're talking about, the doctor and the patient relationship, but even if you work in the front part of the office, like, you can still be human to human, be like, hey, I'm going to stop my writing for a minute and acknowledge that you're present and here for a reason. Yeah. And also you're a paying customer, so you should be nice to, to them.
Right. I have a choice, and my choice could be to leave this office now because I'm not really engaged the moment I walk in here. But then there's the flip side of it where they're too friendly, too obnoxious, too like smiley, too bubbly. And it's not, when they deliver a treatment plan, maybe it's like, just a little bit of bleeding. It's no problem. We'll do this. And I'm like, I want to stab myself in the eye.
Well, we'll never get bubbly with Michelle. Don't worry.
Don't worry. I'm like, your teeth are going to rot out of your head. I'm kidding. This has nothing to do with the actual episode. The episode that we're going to have on today is all about dental hygiene and healthcare, and how we are such a key entity to healthcare delivery. And what I loved about Mary is that you're going to hear on the podcast, she'll be our first interview next, is that she is an RN and an RDH. It's just so cool. I love it.
I do think that is a trend that's happening more and more.
And she brings up a lot of good points. I want you to make it to the end of it because, the grass isn't always greener. We talk about that a little bit. And one thing that stuck with me is that you are going to have to deal with death as an RN. She's like, babies die, young people die, old people die, everyone dies. And like, you have to deal with, if you're on
this is the worst teaser. Yeah. Keep listening to this guy. It's going to be great.
But you might be able to be fine with that. And that's what the point is, like, the grass isn't greener. Everyone's like, oh, I get better benefits, like whatever. She's like, you're going to have to work holidays. You're going to have to work, 12-hour shifts. And if somebody calls in sick, you're there until you get relief.
Right.
And that's a very different kind of thing than being an RDH, where we might have some downsides to what we are or how we practice, but it's more of like, you got to look at the bigger picture. Just because you're struggling as an RDH and maybe you haven't found the best office for you, going to be an RN might not be the answer for you. You just have to reassess like what's your struggles right now. So And then we'll talk about healthcare hygienists after that with Jamie. So we hope you enjoy this episode with Mary and Jamie.
Hey, Michelle.
Yeah.
It's time for the interview.
Oh, but I had something else to say.
We need to let the experts talk now.
Fine. So listeners, I'm really excited to bring on a guest. Her name is Mary Signorino, and I was introduced to Mary by one of our favorites, Joanne Garinlian. And what's so cool about Mary and her journey is that Mary holds a dual degree as an RDH and an RN. I think that's so cool. And welcome to the podcast, Mary.
Thank you for inviting me.
You're welcome. So tell us when you started as a hygienist.
I started as a dental hygienist a long time ago. I went to the University of Missouri at Kansas City. I guess it was almost 41 years ago. Studied at UMKC, got the BS in dental hygiene. Worked as a dental hygienist. I was happy. Worked in a very nice private practice for about a decade. It was owned by a retired naval officer. And what he taught me in that first decade has stayed with me the continuing 3 decades. The way that he was organized, the way that he approached a situation or a problem. I think about him all the time. So after 15 years of being in dental hygiene, I wanted to expand how I could take care of a person. I didn't switch necessarily from dental hygiene to nursing, as I felt like I continued. I studied the head and the neck, and now I'm going to go from the neck on down as a nurse.
I love that.
Thank you. I had also intentions of being in the operating room. My sister is an operating room nurse, and she's very kind and really very loving. I adore her. She is a great person, a good influence. And I wanted to work alongside her in the operating room, and I wanted to do maxillofacial surgery. So that was what inspired me to continue on.
Okay. And then when did you get your RN?
Well, I'm going to back up a little bit, if you don't mind, for a second.
Sure.
I also had a wonderful opportunity in my life to work as a dental hygienist in Switzerland. I worked in a private practice where I spoke German with my patients. I had access to not just visiting the dental office, working in the dental office, but also experiencing nursing from a hospital setting in the Swiss. That influenced me also. But I thought maybe I could do something a little bit more. And I went to nursing school then after 15 years of being a hygienist at St. Louis University. We were the first university to have the accelerated option program in the United States. I qualified for that because I had a very solid dental hygiene education. Dental hygiene education opened my door to not just nursing, but it opened my door to Switzerland. So I embarked on that, got my degree, had some children, and ended up at Missouri Baptist Hospital. I've been here almost 20 years. I work on the renal floor with a terrific group of nurses. And as I said, I didn't leave dental hygiene. I merged the two. I worked out at St. Louis University Center for Advanced Dental Education in the periodontal department with a wonderful periodontist who started the program there, Dr. D. Douglas Miley, and Dr. Reyes. And I've been there since. So and periodically they asked me to participate in research projects. I've done 2 research projects. It's been an honor. So I get to work with residents in the periodontal program. I get to work with residents in a medical setting. I get to work with periodontists in a dental setting, surgeons in a medical setting, wonderful nurses in a hospital setting, wonderful hygienists and staff at St. Louis University. So I'm very, very blessed. I'm very, very lucky and blessed.
So I'm curious, like when you're with your nurses, do they ask you any like oral health questions? And if you're with your hygienist colleagues, are they asking you like systemic nursing questions?
Oh, yeah, that's always happening. As a matter of fact, I just called a friend today to give her a referral to someone that she needs to see down at St. Louis University. Yes, I always get a lot of questions. Over the years, I've done numerous presentations on oral care to the nurses. Yes, I have gotten situations down at St. Louis U where I've had to address some general health. I had a situation where I thought someone was having a stroke. So I did the quick FAST, the fast that we do for stroke. And
Will you break that down for us?
Face, arm, speech, and time. Fast. And we look at the face, the symmetry of the face, if there's any facial droop. Arms, they stretch their arms out. They lift one arm up. If it drifts down, then you might be having a stroke. Call 911. Face, arm, speech, what's your name? If they can't say their name, or it's difficult for them to even get a word out, they might be having a stroke. Call 911. So face, arm, speech, and time. You want to call 911 immediately because there's only a window of time. We call it from door to needle, where if we're having a certain type of stroke, we want to make sure that we infuse what's called TPA, the clot buster. I know you've heard of all of this.
Yeah.
We, as hygienists, we know all this. That's right. And so you want to identify that as quick as you can. In this particular situation, my patient was not having a stroke, but rather she had a pacemaker defibrillator that was experiencing a slow beat, a bradying down device. She refused to let me call 911. I was having a fit about that. But she and her husband were there. They immediately went to the hospital. She wanted to go to the hospital exactly where her cardiologist was, and I don't blame her. But anyway, by the grace of God, yeah, she did fine, and that's what it ended up being. So there's a lot of different situations. I've had people in the dental chair with somebody had a wound on their ankle, and it ended up being that a spider had bitten her and she killed the spider, but it was a brown recluse.
Oh.
So we didn't go any further with that appointment because the spider bite was draining. So yes.
Yeah.
Yes.
Okay.
We got her to the ER. She went immediately to the ER associated with SLU, and we got that taken care of. Did I answer your question?
Yeah. So,
Okay.
and I'm also curious, when you are working with your nurse colleagues or even with patients, are there oral health questions and things that you talk about?
Oh yeah. I've had many people come up and ask me about this or that, or can you take a look in this person's mouth? I've had to re-demonstrate, which I don't mind, suction tooth brushing and the principles of it, which we're going to be reviewing again for Joint Commission. In my own patient care, I have found 3 separate cases of possible oral cancer, and I do an oral cancer exam. If someone tells me that they're having, if I ask them certain questions when I do my morning assessments and throughout the day, and if something kind of, cues me in, I'll do an oral cancer exam. And in this case, I was right about the 3 separate incidences that I had. I immediately called the primary care physician, denoted it in the EPIC flow charts, and made sure that the referral was made to our ENT and our oral surgeon there. And of course, calling the doctor, telling them, that I also am a dental hygienist and this is what I see.
What do people say when they know that you're an RDH and an RN? Is that interesting to them?
Some of them are scared. Are you kidding? Some of them,
because they don't want you looking in their mouth.
Exactly. And some of them run away. And it's I didn't tell anybody that I was a dental hygienist at the hospital for a very long time.
What was the reason for that?
Well, because I was there to do nursing, not that oral care is not nursing, but I felt as though I knew that in time.
You wanted to learn nursing and not like talk about oral care all the time.
I talked about oral care with my patients. I always have. I just wanted to prove myself as a nurse.
Yeah.
And if you prove yourself that, yes, I can do this work with you, then people will listen to you. But when you walk in and you say, you know what, I'm a dental hygienist and this is what you should be doing, you lose all credibility.
Yeah.
You lose all credibility. And I knew that I had to take my time doing this. And I was right about that.
So is there a way that we could engage with our nursing, and I want to say colleagues, because they're colleagues in our healthcare profession? Is there a way that we can engage and have an open dialogue so that they appreciate our knowledge and we appreciate their knowledge?
First of all, there are so many nurses who are so passionate about oral care.
That's so good to hear.
Yes, more than what we know. There are 3 initiatives, one major initiative that you will be hearing about or is going on now. So the thought that nurses don't care about oral health is not necessarily true. That might change from individual to individual. The best thing you can do is just talk about it. I was on an oral care committee, and I'm going to be on another evidence-based project with another group of nurses. And what we are doing, what I'm doing, actually, it's funny you should ask that question, is that the nurses and the hygienists, we are going to be going out to dinner in about 2 weeks. So we are going to get to know each other and share some things. It's going to be fun. The nurses are excited about it.
So how is that happening? Is that with an association or is that with your hospital? Did you invite people? How are you making that happen?
Well, someone contacted me about an evidence-based project that they're on. I remember I've been at Missouri Baptist for 20 years, so people now know that I'm also a dental hygienist, and so they just start talking. I don't know, and also my dental hygienists have we've done different things together, like we gave a stroke presentation at a dental conference in 2017, something like that, where that was a lot of fun, a lot of work though. So I had a team of hygienists and a team of nurses and a speech pathologist, our stroke coordinator, Dr. Hedlid, and a pediatric stroke neurologist from Children's Hospital here in St. Louis. And we went over strokes from childhood, infancy, in the womb, up to adult. So there's a lot of opportunities out there. I just kind of make it happen and bring them along with you. We just did a in-house presentation on oral health and diabetes, and my hygiene friends were with me. So that's how it works.
I'm curious because in my past, I guess, CE attempts with nurses, I have tried to invite them to CE courses, but because they work for hospitals, they get that free. And so they're not going to pay for any of the courses that are out there. Is there do you think just having like a social hour where maybe somebody does come in and give some feedback, maybe a 15-minute presentation on dental hygiene, 15-minute on nursing, and that way we could appreciate each other? You think that's something that a lot of people like to do versus coming and sitting for a 3-day or a 3-hour course?
I think with what's going to be coming up in nursing and how oral care and understanding infectious disease, central line infections, especially our non-ventilated hospital-acquired problems.
Pneumonia.
These issues have opened the door for a lot of what you're talking about, Michelle. It's going to happen much easier because now there's a commonality.
I'm curious too, what are some of, like, when a nurse is going to go in and do oral care, what are they doing and why are they doing it?
Well, that's what we have to talk about. That's why we have to educate them. Some of them, you have to overlook some things.
Like
get where you want to get. You're going to see some pretty bad approaches to oral care.
And that's because they just weren't taught, or because they don't even understand the oral cavity?
First of all, take a look at them. You can't tell someone to care unless they care themselves.
Yeah, care for their own mouth, right?
Right. And so there, like I said, a lot of nurses care passionately about oral care, but some of them just haven't been taught how to properly brush their own teeth. If you talk about how to take care of their own teeth, then they're more apt to remember how to take care of that person in the bedside, how to take care of that situation.
So my thesis for my master's degree was oral care for critically ill patients. And I did a survey in 6 ICUs at my local hospital, Medical University. And some of the things that I remember reading was that they were not comfortable identifying dentures, partials, how to put those back in so the patient could start eating. They knew what yeast infections and candidata or DITA, I always say it wrong. They knew what it was, but they might not be able to identify candidiasis in the mouth or abscesses. Like a lot of oral lesions, they were like, yeah, we don't really know. But interestingly, they did not want a hygienist in the hospital at the time. And this was, back in 2012. So we're looking at 8 years ago.
You do have a hygienist working in a children's hospital in Arizona.
Yes.
I heard her speak. She's doing a wonderful, wonderful job. So what's going to determine whether we're going to get into a hospital is going to be if it's beneficial to the hospital. And I think that's what's in transition right now. And that's what's being discussed. Because what we do as hygienists prevents a lot of illness.
So true. It's so true. Especially ventilated associated pneumonia, which a lot of our listeners may know or may not know. VAP is the acronym for it. And ventilated associated pneumonia, the last time I checked, had one of the highest morbidity rates of a nosocomial or hospital acquired infection. Is that still the case?
Oh, no, we've done a great job. Nursing has done a great job addressing that.
That's great.
People helping them to address that. They're doing oral care every 4 hours. They have what they call the bundle. So they have, product in it. Unfortunately,
not great product.
That's right, because, and again, that goes with the people that purchase items for the hospital. Yes, they're not the quality that a hygienist that you and I would necessarily want. But you know what? They're getting the job done. And I haven't looked at the statistics in a while, but someone told me it's phenomenal. So we've been working at VAP for 25 years. And now we're looking at non-ventilated hospital-acquired pneumonia. And that's where we're really going to make a difference.
And is that where they're just getting more aspiration pneumonia? Or how do they get non-ventilated associated pneumonia?
Well, it's poor oral care. And the poor oral care in the hospital, yes. It's going to be reportable. So that's what's on the horizon here. Actually, it's here already. And there's a lot of exciting things happening for nurses and hygienists.
So when someone is in the hospital and they are, let's say, I diagnosed, I don't know if that's the right word, but they're diagnosed non-ventilated associated pneumonia. Is that because they've been in the hospital for days upon days and just haven't had oral care? Or did they come in with what we would say periodontal disease and pretty aggressive oral infections?
Now, I believe they started with it, but yet researchers are saying, well, we didn't. They came in, they didn't have it. After we intubated, they did. So that's the origins of it. So we don't, because we don't have dentistry in the hospitals yet.
Doing triage and stuff like that.
In your lifetime, in your career as a hygienist, you will be in the hospital.
Oh, Mary, I hope you're right. I don't know. I don't feel it in my heart. I think it's going to be after I retire. but I hope that we can see that.
Yeah. But there's a really wonderful, most nurses, all hygienists, we're really the same. We're really the same. We're, as hygienists, we are nurses. We start as nurses that were studying oral care, the oral head and neck anatomy. That's what we were many years ago. So I consider us to be nurses.
When you think about your fellow colleagues as nurses and then your fellow colleagues as RDHs, is there one or two commonalities between us that you identify a lot?
Oh, we always care. There's always a passion. There's a mission somewhere deep inside us. I know that sounds silly, but it's spiritual.
Spot on.
Yeah, it's spiritual, and everybody learns. As a hygienist, I learned a lot from nurses, and nurses learn a lot from hygienists. And we make, if we didn't have each other, there would be more people, I think, that would have more respiratory infections, more non-ventilated hospital-acquired pneumonia situations. If it wouldn't be for hygienists seeing a patient every 3 months, 4 months, 6 months, whatever, what we do with those biofilms and how we keep that all to a minimum, and how that affects our general health. That part of our population, we keep them healthy. We help them keep themselves healthy versus the higher acuity people that we're taking care of in the ICUs and on our renal floor. Then, that's different. The people with the comorbidities, that's more of a challenge in the sepsis situations.
Well, I've always thought that what hygienists are doing is kind of wound care for the mouth, and nurses are out there doing wound care and the rest of the body.
And that's exactly what I tell my nurses when I talk about scaling and root cleaning. I said, we're doing wound care. We're doing a sophisticated form of wound care.
And a place that we can't see very well, right?
Isn't it fun, though? I love scaling.
It is so. It is fun. It really is. And I really enjoyed meeting you and hearing your journey. I think it's fantastic that you hold both degrees. I think that's amazing. I have one question for you to end our interview. And that is, so a lot of times on these forums for social media, we hear people that are getting really burned out with dental hygiene. And they think they're going to go and be a nurse now. They're going to go to nursing school. And I'm curious if you have any advice for someone that might be getting a little burned out as a hygienist and going to nursing school. Because in my head, I'm like, well, maybe nursing is a better option for you. You might just love that. That might have been the better one for you. Or sometimes I'm like, the grass isn't always greener.
That's exactly right. Now, if you're going to go into nursing, you have to come to the couple realities. And that is the schedule. You're going to work nights. You're going to work holidays, at least 1 or 2 holidays. You're going to have long hours, 12-hour days, which hygienists, we do that too. But that 12-hour can change into an 18-hour. If there's bad weather out there, stormy weather, snowy weather, there's a situation called patient abandonment. If people call in sick, you're going to stay. And if you're going to stay, you might have a sleepover. And most important is that in hospitals, people die. Babies die. Children die. Teenagers, adults, and old people. And so it's getting used to death. One should never get used to death, in my opinion. And losing your first patient, whether it be that they drift off in sleep or it's a code situation, is difficult to negotiate for a while for a new nurse for many years, and you'll remember it. Knowing how to take care of yourself after a failed code is very important. We have a program called Second Victim, which addresses things that have happened to nurses to keep them in the profession. So we've got to think about the reality. Yes, nursing has a lot of advantages, but also life is lost. And are you really ready to see that?
That's a good point, and one that I definitely did not think about. So I really appreciate your time, Mary.
Well, thank you, Michelle.
This is going to be great. I think people are going to really appreciate knowing that there's somebody out there like doing it all, doing it both, practicing on both sides of the healthcare.
I want to say that anything that I said in this interview, I was not intended to be negative towards dental hygienists or nurses. I love them both. And there's pros and cons to everything that we do.
Yeah.
But what we do together is we keep people healthy.
What a great final remark. Love that. Well, Mary, thank you so much for coming on. If anybody's has questions, your email will be in our show notes and they can shoot that over to you. But best of luck in both your dual careers. And we love having an RDH on the RN side. It's great getting to know you.
Thank you.
You're welcome.
God bless you.
Okay, listeners, welcome to the second interview in this episode. It was such perfect timing. Jamie, I want you to introduce yourself because one, I know I'm going to butcher your name because that's just what I do in life, apparently. So please introduce who you are and what we brought you on for.
Thank you very much for having me. I'm a fan of the podcast, so I'm very honored to be here. My name is Jamie Freitag-Dooley. It actually means Friday in German, so that helps you remember how to say it. And
that does. Thank you.
Yeah. And I am, of course, a registered dental hygienist of 22 years, 23 this year. And I have a background in life and business coaching and program development.
Very nice. And you have a new project, little baby that came out just recently.
Yeah.
Tell us about that.
It's kind of like a baby elephant, I would say, because this is going to be a really big baby. I, a few years ago, had an idea that, if hygienists were certified like nurses, that we could specialize, and probably healthcare systems would implement us. They would start to utilize us due to hospital accreditation and everything. I knew certifications would be important. And I said, we. And finally someone said, what's this we? You need to just start this. So I started the National Network of Healthcare Hygienists, and that's what we'll be doing. We'll be certifying hygienists in different areas of medicine to specialize.
Is there like a starting point that you would like the hygienist to get into? Because for me, I know nothing about that field. Like, what would I be even qualified to start out as?
Well, none of us are. Some of us have master's degrees. Some of us have worked in maybe FQHCs, federally qualified healthcare clinics. I have a background in public health too. So some of us have already done different integration projects at work. And so the people that have a heart for this typically have attempted some form of integration, like I did for my alma mater, Ferris State University, with a large healthcare system. And when I found out all of the barriers that were present, I knew that we needed to do something big to change it.
So what does a certification look like? Like what would the education and the goal be? Is it for a hygienist to go work in the ERs and the ICUs, or is it for a hygienist to go be in the nursing care facilities, or all of it?
So we are brand new. We just launched official membership in January of 2020. So membership is currently closed more than likely, but depending on when you're listening to this podcast, you can certainly go to our website, healthcarehygienist.org, and see if membership is open. We are grassroots. This is still our startup, first year as far as board restructuring and curriculum development. Chris Potts has come aboard as our curriculum developer, and we are so honored to have her. She has lots of ideas. I have an amazing board, so I've really just allowed her to take this, and I know whichever certification she comes up with first, that it's going to be awesome. Some of the common ones that we're seeing requested are diabetes, airway, different respiratory. We've had a lot of interest in health coaching, which I think would be excellent for a primary care situation, a primary care office, so that you've got a hygienist that's the bridge between the dental world and the medical world. And they would really become like a care manager, helping that patient navigate through all the complexities and differences between the two systems and communicate with the dental teams because our language is so different. What I found out during the pilot program that I ran for Ferris State University was that the two systems were so siloed. I tried to train providers in oral health. They didn't want me to train them. They just wanted me to do it. They said, can't you just do it? Can't you just come in and do it for me? You went to school. You've worked for 20 years. You know all this stuff. I don't have time. My brain can't fit it. We need the experts. And so it was very clear to me that they look in the mouth, past the teeth, past the oral cavity, down to see the tonsils, and they just don't feel like they have the time or the know-how. So it's really exciting that hygienists are perfectly poised, because we are the primary care providers of dentistry. We're perfectly poised to be that bridge between these two silos. People keep saying break down the silos. That's not working. So we've got to be the bridge.
And you have a really fantastic video out called The Best Kept Secret in Healthcare.
That was one of our members, and she created that and shared it. And so I thought, my goodness, everyone's starting to align. The mindset certainly is starting to align within our profession that, we all say we need autonomy. However, what needs to come before autonomy? We've got to level up. We all have to level up. So if you've got your associate's degree, consider your bachelor degree. You got your bachelor degree, consider your master's degree. We've got more doctorates than ever before. What an exciting time to be a hygienist.
Can I ask though about that? Like, you see on the forums all the time, and you do some coaching. If someone comes to you and was like, hey, what type of degree do you think, would be the next level up? Where do you steer them towards?
So in my private coaching practice, it's all based on helping them go within. People get confused when they look outside of themselves for answers. As a life coach, and honestly, and as a business coach too, what I'm doing is I'm helping people go within and hear the whispers of their heart. You guys know how we're programmed. We're type A independent control freaks, which is good in a lot of ways, but we don't take that quality alone time to go within. I say, take yourself on a date, bring a journal, bring a notebook, buy yourself a glass of wine or a cup of coffee, put your feet up and write and listen to what your heart calls you to. So that is always my guidance. And people know it doesn't take long. It doesn't take a lot of conversations with me to know this is the demographic I cry over, right? There's that one group, there's that one illness or disease state, or, I have a daughter with spina bifida. So of course, special needs kids are a draw for me. What tugs at your heartstrings? And then that's usually the answer. And you may or may not need to go back to school.
I've moved more into that than ever before. I have my master's. I love my master's degree. 5, 6, 7, 8 years ago, definitely. And I would say even 4 years ago when we started this podcast, I would have said, yeah, a minimum of a bachelor's degree. And I still feel that. But at the same time, I don't think a master's is for everyone. I think it's about what you are wanting to do and going get an education in that. And for me, it was teaching. So a master's just, that needed to happen. But I'm thinking, like, if I had my bachelor's degree and I saw something like this out there, I've always wanted to be in the hospitals. Always, always, always. Like, this would have spoke to my heart so much. And I would have jumped on the opportunity to get a certificate or find someone to help me get into the hospital and be a provider in those situations. I love it. I love it. And you also have a white paper on your website, healthcarehygienist.org. And in it, you talk about the silo effect. And I just wanted to read a little excerpt because I thought it was really great. And it was like this: despite the prevalence and severity and cost of this largely preventable disease, oral disease has not received the attention it deserves. And for too long, oral health care has been separated from routine medical care, with some considering it discretionary. And I saw a really funny meme that I've since quoted where they're like, apparently insurance thinks that teeth are luxury bones and they're optional. Just luxuries. You're optional. It's just, I keep them and I keep them healthy. If it's just a luxury to have that. And so I really think it's an important message. And I love this idea. I really do.
It's a little bit of a journey to get to the question. So follow me with this. Okay. So historically in the dental side of things, we have, this battle between general doctors, general dentists, and specialists, and who's doing what type of work, implants and extractions and surgical extractions and those types of things. And then we have the restorative hygienist / mid-level practitioner of some sort encroaching upon the dental space. When we're now talking about the bigger picture of healthcare and what it sounds like you're trying to help bridge this gap, do you feel like there's going to be that same type of pushback from the private practice healthcare professional versus something like public health, where I think that's a lot more accepting to what you're pushing right now?
Well, we know that every single state has different laws. And so we are not defining the job description of a healthcare hygienist. This is going to evolve. This is an elephant. I think I figured out like the trunk. That's it. So this is going to continue to evolve, and we all have a voice in where this goes. So that's the exciting part. This is my idea. I'm a developer. I love to take new ideas. Steve Jobs said, the people that are crazy enough to think they can change the world do, right? And so I'm the crazy one. I'm stepping forward going, I'm crazy enough to file 501c3 paperwork. And then everybody else is going to have a say in what this becomes. I mean, it chokes me up. I get so excited and emotional over it. To think of where hygienists will be 20 years from now, I in no way think that this is better than clinical hygiene. I can't work clinical hygiene anymore due to pain and numbness. I was dropping my 204S every single day. There comes a point where you go, okay, how else can I use my skills and my abilities and my knowledge? And this is absolutely one of those ways. So I don't think we're going to get the kickback from private practice medicine. I think they're going to say, we had no idea what you knew and what you were capable of and how bad we needed you. And we're going to improve outcomes. You guys know that. I mean, there's no doubt that addressing the elephant in the room, unaddressed dental need and unaddressed oral health, is going to change all systems, patient outcomes across the United States.
So this is 8 years ago, maybe even 9 years ago, that I did all my research for my master's degree, but it was on having hygienists in the critical care units. So I did a survey of 6 of the ICUs at my medical university. And I sent out a survey to all of the nurses asking them, one, I was kind of comparing what are the protocols for oral care? And then are the nurses actually practicing it? And then is it in their curriculum? And the feedback I got at the time, again, this was 9 years ago when I probably sent the survey out, that a lot of them wanted no part of oral care, but they also wanted no part of me being in there. And I think, though, what happened with that survey, I think I would have gotten a very different response had I been there to give the survey and said, you are doing an amazing job. I want to take a job that you don't want to do. And I think a lot of them saw that survey as, don't tell me I'm not doing my job correctly. So I think the survey would have been a little bit different. But what was interesting is for all the people that were saying, don't come, no, we got this, girl, thank you, but no. They were also saying, I can't recognize candidiasis. I can't recognize an abscess. I wouldn't know what infection in the mouth really looks like. I don't know how to put a denture in. If my patient has a denture, I don't know how to put that in their mouth so that they can chew their food once they are allowed to have food. They didn't know any of these things. I think they want it. I really do. But I do think that there is some pushback. I do think there will be a little bit because people really just don't know what we do. Our profession sometimes doesn't know what we do.
They so do.
Yes.
Right. I feel like we're the forgotten provider. We're the most underutilized healthcare provider in the United States, and we're just kind of forgotten. And I feel like our patients need us, not just the ones that can afford to go to the dental office, but the ones that can't. They still need us, and we have to go to them. And so I spent a lot of years in mobile dentistry. I created a school-based sealant program and saw the need there and the effect. And now I want to have a bigger impact. And I need everybody. I need all hygienists to step forward and say, I'm willing to help in my community, whether you're educating a small group of nurses, maybe even school nurses, or whether you are saying, yeah, I'm going to dedicate myself to dental hygiene, get a doctorate, get all the medical certifications, whatever it is. We just all have to do our part in our community. That's where we start.
Are you seeing an excitement amongst hygienists about this movement?
I am. In fact, with our founding members, we had about 104 people join last year as founding members before we had anything to offer them except an idea. And so I've offered them free coaching calls, and I'm in tears on almost every call because they're so excited, they're so ready, they're so passionate, and they have felt so down on, whatever has gotten them down. Some of them are in pain. Some of them have worked for really bad offices, really bad situations, and have been neglected or treated poorly. I've been so lucky to work for such good dentists. That was never my problem. Did I feel a calling to do more? Yes. But it's sad to hear how some of our own are being treated out there.
I'm curious if there's any discussion or movement or ways to enlighten the hygienist that just thinks they're there to clean teeth. I bring this up because, of course, it's always, and I'll see one forum every week that's like, she's like, I just want to clean teeth. That's what the patient wants. And I'm like, but you gotta tell the patient what they want sometimes. Like, that's not what we were meant to do. And I don't want to be disparaging of the people who are out there clocking in, clocking out, because we all do it in some way, sometimes, some days. But is there a way to help them change their mindset to see something like this as what they're really meant to do?
Well, I think that AOSH is helping. If you haven't checked out AOSH, what happened is, medicine got so complex that people needed to start specializing. That's why the nurses got their certifications. They couldn't possibly keep up with all the not even the standard of care, but best practices were like impossible to keep up with in all areas of medicine, and dentistry is getting similar. So I think that some of the hygienists that just feel like they're there to scale, maybe they just feel a bit overwhelmed with, I've been out of clinical for 8 years. I know nothing about airway. I'm going to take the certification when we create it because I know nothing and I want to help. My husband has sleep apnea. So how can you find something in your life, maybe and start there? So for instance, a special needs child, learn more in that area, or sleep apnea or diabetes. How can you help somebody in your own inner circle? And maybe just start there. AOSH has a ton of information.
And I love the idea of specializing because, well, actually, Daniel Lopez is the one I've gotten a huge argument with before. Shocking, I know, if anybody knows Daniel, because I always said I'm a perio hygienist.
Me too.
I'm perio. And I've never worked restorative. I'm in an outreach public health facility now. So now we do have restorative, but the level of perio I'm actually seeing now is far worse than what I saw in private practice perio. But he would get so angry at me. He's like, why are you so different? Like, you're just going to be an elitist. I'm like, what I say and talk to my patients about is different. The instruments I use are different. The technology I have in my office is different. I'm talking lasers and implants and tissue grafting and bone and foundation. There's not a moment of talk about crowns and it's just different. And so I have never really understood why we got so angry at specializing because I don't do pedo. Like, Andrew's done pedo. God, could you imagine me doing pedo? No, you guys got this.
Right.
Yeah, please. Exactly. You got this. Don't ask me to do pedo. Somebody's like, I'm a pedo hygienist. I wouldn't take offense to that. So I'm really excited to have a specializing type of certificate, or just being okay with working a certain type of part of dentistry.
Yeah. And we need those people that just want to work in private practice doing prophies. We need them. So I think that what's going to happen is you're just going to see more and more break-offs of holistic practices, mid-level. Like, I'm in Michigan. We just passed the dental therapy bill, but it's going to take a little while for the curriculum to be developed. So everything takes time, but within 20 years, boy, are we going to see a lot of, I think, diversity and kind of sections of hygiene, which is really exciting.
That's really exciting.
But you won't have to. If you love doing prophies, 45-minute prophies, go for it, because you're going to be needed too. You might be doing them in malls. You might be doing them, right? I mean, you might be doing them in kiosks. Yeah, in the mall.
But you know what? You're right. There's a point for that, because right now I have no disease. I just sometimes want to get, which is probably what I do for myself in my office when I polish my own teeth and get the stain off.
Exactly.
It was perfect. Oral cancer.
Exactly. I love my hygienist. She says I'm her easiest patient of the year.
And she's probably right. So are there any other things that we want to tell the audience about as far as the future of NNHH? Where should they go to find out more information? Do you have like a timeline? Did you say you had a timeline maybe for when they could start curriculum or taking the certifications?
We are hoping our very first certification will be ready to go this summer. It's dependent on our membership drive. So depending on how many members we get and how many dollars we have flowing in, we are looking at making everything very much like the nurses' certifications. So approximately 40 hours, quizzes, tests. It's going to be like a mini, going back to school. Not full blown. I don't want to scare people away, but it's going to be more weighty than just a CE. So if you want to check us out, we have a Facebook group that's free. It's probably the easiest way to stay up to date with where we're at with membership and certifications. And that is Hygienists in Healthcare. And that's on Facebook.
I really also encourage everybody to go to the website and download this white paper. I mean, there's just a lot of data and quotes.
I believe that was from ADHA.
The white paper?
I believe so, yes.
Oh, actually, it's from National Interprofessional Initiative on Oral Health, DentaQuest, REACH, and Washington Service Foundation.
Yes. I think we have two on there. There are two white papers. You're correct. So
this Jeff particular Hummel, one is Oral Health, an essential component of primary care.
Yes. Jeff Hummel was part of that white paper. He is a physician married to a dentist, and he was helping us. He now works for Comagine, Comagine. He was helping us figure out, if we're in healthcare, how are we going to get paid?
That is very good. It's a good question.
That was one of the barriers that when I did my pilot program, they said, we'd love to have you. We just want you to do it. But how are we going to get paid to have you here? I actually worked with the Spectrum Health upper level administration and found out there's a need for us and they want us, but they don't know how to get paid utilizing us. So we found a code, 99210, I believe is what it is. I don't have it in front of me, but it allows for an auxiliary professional. It doesn't say who, it just says
that gray
if the physician
area.
orders it. Yep. If the physician orders it, the physician or mid-level provider does not need to be present for the appointment. And the approximate fee is $40 and it lasts 5 to 10 minutes. So we feel like an oral health screening by a hygienist would be a very valid use of that code. And Jeff helped us find that code.
That's great. Now, how does that work with in each state and their general or direct supervision?
So that is why we're saying that because we don't have state to state, license carryover and we don't have autonomy yet, but I do believe we're headed in that direction. It'll be interesting to see how this works. As soon as we have enough money to run a few pilot programs, we will absolutely be doing that and are open to funding opportunities. We're happy to, to talk to any potential funding partners about running these pilots.
That's awesome. Andrew, you have anything that I might have missed?
No, I think I'm good. No, I think you hit it all.
Well, Jamie, thank you so much for taking the time and introducing us to this. This initiative is very cool. I hope it takes off faster than anything else, since even in dentistry, we tend to be a little slow on the uptake. But I hope it really does take off quickly, because I think it is a missing link. I truly believe that.
Awesome. Thank you very much for having me, both of you.
And where can people find you if they want to do any business coaching or find out more information about the services you provide?
So you can find me on Facebook, and you can also find me at jamiedooley.com. It's the boy way, JAMIEDOOLEY.
Perfect. Well, thank you. Best of luck. Everybody go check out healthcarehygienist.org, and you can also find them on Facebook. And best of luck.
Thank you very much.
Well, we hope you enjoyed that and are also feeling the feels that we are actually healthcare providers. Like we are important. We are key elements. And also maybe you can go and do something really fun and cool like Mary, where you are dual professions. I love that. I just think that was a really fun interview with her and Jamie as well. And this whole healthcare hygienist. Can't wait. So what do we have up next? I mean, we're going to finish here at Chicago. I'm going to Hinman. Brittany and I will be at Hinman actually next month. And we'll be doing some podcasting there. By the time, I'm getting confused with all the interviews because we just did one, not coming out for a few weeks. But
very excited about that one.
When we do these interviews, I'm always on this like nerd high and I get excited and I want to tell people about it.
There's a really good one coming out, guys.
Yeah.
I'm sorry. It's mean to tease, but I really enjoyed him.
It's so great because someone asked us like, what's your favorite one? I was like, that's like picking your favorite child.
Hard. Well, which I don't have a hard time doing.
Well,
it's
yes,
Molly.
we all know you love Molly. Molly's great.
Yep.
But also for me, let's say who's your favorite nephew? Well, I get them each individually. Like I don't have them all together.
Right.
So the last one I was with is probably my favorite.
Right. No, that makes a lot of sense. I mean, it really is hard to we couldn't even do like a top 10.
I don't know.
Top 50.
I mean, I can tell you right now, I've listened to Dr. Stashagoma Next episode 5 times. Minimum.
Nice.
Minimum, because I'm trying to get my vitamin D levels right. The myofunctional I've listened to at least twice with the babies because I've sent 2 people to myo and referred them, just my friends at this point. But yeah, there's some really good ones. Sometimes when I'm like, Dr. Pam said it this way on that podcast. Like I'll go back and listen to it and then go, God, that was a great episode.
Yeah.
Yeah. But if you haven't listened to all of them, please check them out. And if you have ones that are your favorite ones, we'd love to know about those. And we'd love for you to share them with your friends and your colleagues. If you are ever going to student events or, maybe you go back and to your alma mater, tell the students about us and get them engaged too, because we would love for them to learn this way. You should definitely follow us on Instagram. Check out our Chairside Chats right now. Let us know if you want to learn anything more. We also are doing Science Sunday, and you can find all of that on our website at tale2hygienist.com. And you can definitely sign up for our newsletter that we will be sending out. And also, if you haven't noticed, we've been doing some really killer giveaways with our tipisodes. So make sure that you are listening to the tipisodes and signing up for those giveaways. And so follow us on Instagram, LinkedIn, Facebook. Download us, like us, review us. We would love a rating and review. And thanks, guys. We hope you have a great week.
Thanks, everyone. Goodbye.
Bye, y'all.